Hi, my name is Jessica Fish. I'm adjunct faculty with College of DuPage's Department of Nursing. I'm here today to demonstrate urinary catheterizations for males and females. Let's get started by taking a look at a patient's chart. I have Morgan Brown, date of birth August 4th, 1970. Medical record number is 278884. And I'm looking right now for an order for insertion of Foley catheter. And I see that I will be inserting a Foley catheter if my patient is unable to void 6 hours post-op. When we go in to discuss the plan of care with the patient, we'll make sure that she has not voided more recently. I'm also looking for allergies, most specifically allergies to shellfish, any betadine or iodine products, or any latex products. I see that my patient does not have any known allergies. Let's go and gather our equipment. I have 2 sets of sterile gloves, 2 urinary catheter kits, 3 soap towelettes I will be using for pericare, and I've already placed a blue pad underneath the patient for pericare. I will also be bringing in an alcohol swab and lubrication spray. This is specifically for the mannequin for mannequin safety. Now, when we look at the urinary cath kit, we are looking specifically at the expiration date, make sure it's not expired, and we're all good to go with that. And we're also looking at the size. I have 14 French here, and 14 French to 16 French is appropriate for a female, and 16 to 18 French is appropriate for a male. Okay, let's go to our patient's room. Hi, Mrs. Brown. My name is Jessica. I'm going to be the nurse working with you today. How are you today?
Fine.
Good. I have some questions for you. First of all, what is your first and last name?
Morgan Brown.
Okay, and what is your date of birth?
8470.
Good. And I'm just going to be checking your medical record number with what I have. 278884. Perfect. Okay, and let me just make sure that you don't have any allergies. Do you have any allergies that you know of?
No.
Okay, no allergies to shellfish or latex products or betadine or iodine?
Nope.
Okay, great. So let me ask you, when was the last time that you urinated?
Oh, I think last night.
Last night. Okay, that was a little while ago. What I have is I have an order for urinary catheterization. And what that means is I'm going to be inserting a tube inside your urethra, and it's going to be sitting in your bladder, and it's going to help drain any urine that you have in there, okay? The procedure should just take a couple of minutes. Do you have any questions for me?
Is it going to hurt?
What you might feel is you might feel a little bit of pressure, but I'm going to walk you through all of the steps, and I'm going to have you take a couple of deep breaths right before insertion. That should help with any pressure that you feel, okay?
Yeah.
Any other questions?
Nope.
Okay, let's get started. I'll walk you through it. First, I'm going to be raising the bed to a working, comfortable position. Okay, and I have good lighting. And I'm going to make sure that I provide for privacy. Okay, and we're going to start off with pericare first. There's 2 reasons that you're going to be doing pericare. The first reason is for inspection, and the other one is to cleanse. So what you do is you take your 3 swabs. Okay, Mrs. Brown, this might be a little bit cold, but you should be okay. Okay, 2. And then I have my 3rd one. Okay, and what I'm going to be doing is I'm going to be cleaning from clitoris to anus, from top to bottom, 3 times. So I have 1, then I have 2, and then I have 3. Okay, so pericare is done. Taking my garbage and my gloves, and I'm going to throw them away, and I have to do hand hygiene right away after that. And our next step is getting everything ready for our sterile gloves and positioning the patient. Now, when you position the patient, you want to be positioning her in a lithotomy position, so knees up and legs separated. You do that so then you can have a really good sterile field. Okay, I'm just going to be helping you move your legs a little bit. How are you doing? You're okay?
Yeah.
Okay. So I'm going to place my kit right there. Right there. Okay, and I have my gloves. I'm going to do that right there. So now when you open this up, you want to reserve the bag for a garbage bag. And there's a certain way that you can do that. You don't want to kind of rip it too much, and you kind of want to shake that out so you can keep the inside of the bag sterile. So you see I'm going to do this so the inside remains as sterile as you can have it, in case you want to use this as your garbage bag. And I'm going to put that right over here. I'm going to get rid of this. Now you can have a couple different types of kits. Some will have the sterile gloves inside and some will not. This one I have the sterile gloves outside of the kit. But when you get started, you want to open up the fold away from you first. And then you're going to do the side. And sometimes you might have a corner fold back on you, and you just want to pull those very tight there. And you also want to take care not to touch the inside. And remember that when you have a sterile field, about 1 inch border is not sterile. Okay, so I have my gloves in there, but I'm going to be using these today. Now, do not turn your back to your sterile field at all. Okay, I just moved over to the side. Now, as you are practicing this, make sure you practice your urinary catheterization skills, but also your sterile glove skills as well, because that's equally as important. Okay, Mrs. Brown, how's it going?
Okay.
Good. Okay, now once my sterile gloves are on, I will not be having my hands go below my waist or anything such as that, okay? Okay, I'm removing this. And I have my first drape here. You're going to see a shiny side and a not shiny side. You want to have the shiny side down. This does not absorb water, so if the patient were to urinate or if you were to spill water from the syringe, then it would just kind of bead up. But what you need is wrap your hands around the drape, such as that. Okay, and then you're going to ask the patient just to kind of scoot up a little bit, and you want to place that underneath the patient. And then this is the fenestrated drape. We will be using the fenestrated drape. This provides more privacy for the patient, and it also expands your sterile field. Okay. Now I have the iodine swabs that I'm not going to be using. Then I also have lubrication, which I'm not going to be using. Okay. I have my 10 cc's of sterile water, and what you're going to need to do is pop that back in order to kind of break that seal there. Okay. So what you're going to do first, this is a sterile specimen collection. I'm not going to be using that. But what you want to be doing next is you want to attach the water syringe to the balloon port. Now you do not inflate the water into the balloon port. That can stretch out that catheter tip. So you just want to make sure that that is attached really well. Good. So next step is I'm going to ask my assistant to drop in the alcohol swabs. Thank you, and the lubrication. I'm going to open up these alcohol swabs, and I have 3 of them. I'm going to place them right in here. And then I have my lubrication spray. Okay. And now I'm going to take this plastic protective wrapper off the tip of the catheter. So you want to have good control as you're doing that. There's also a perforation on the side of this bag that you can rip that perforation, or you can control it this way too. Either way works. And I'm going to have my catheter sit inside that lubrication. Okay, and at this point I take a look at my equipment, and I have my swab sticks, I have my water attached, and I have everything with my lubrication. So I'm all set to go. Now what I'm going to do is I'm going to make my non-dominant hand contaminated. So I'm going to place this hand on the labia because I need to be able to visualize, fully visualize the urinary meatus. I'm going to leave my hand here until after the catheter is placed. Okay, Mrs. Brown, first I'm going to clean. And what you're going to be doing with the alcohol swab, you're going to go on the side that is farthest to you. And you really want to exaggerate, over-exaggerate the removal of that, because you do not want that swab, that dirty swab, over your sterile field. Okay, so I'm over-exaggerating that. So I did the side farthest away, then I did the side closest to me, and now I'm going to go down the middle. And once again, you're going from top to bottom, and I'm over-exaggerating that. Okay, Mrs. Brown, we're ready for insertion. And something else, you want to have about 2 to 3 inches away from the tip of the catheter. If it's too close, then you might break a sterile field by touching that. And then if it's too far away, you're not going to have good control over that. So I like to go about 2 to 3 inches away. Okay, Mrs. Brown, take some deep breaths for me, okay? Perfect. Good job. Now we're going to be inserting until we see urine. And once we see urine, we're going to go about 2 more inches. Okay, Mrs. Brown, I see some urine. I'm going to go 2 more inches. You did really well. At this point, I'm going to hold on to that. I'm going to anchor that catheter in place. And now I can insert my water. Very good job. And then I'm going to give a little pull just to make sure that it's sitting in the bladder okay. And it does. That feels good. So now I'm going to detach that. I'm going to remove that. And then I want to make sure that the urine fully drains into the bag, into the urine bag. So I'm going to be placing this, I'm going to be observing the urine, but I'm going to be placing this on a non-movable part of the bed. And there is a hook right here. And then I'm going to be attaching the catheter to the StatLock stabilizer right here. I'm going to make sure there's a little bit of a slack as well. Okay, Mrs. Brown, how you feeling? Was that okay?
Yeah.
You did very, very well. So the next step is I need to clean up my space, get rid of all my equipment here. She did very well. And I'm still checking on that urine. I see about 400 cc's of light yellow urine. Very good. Okay, and I will dispose of my equipment properly. Okay, and then before I leave the patient, I'm gonna make sure the patient is comfortable. So I'm gonna make sure that her call light is in place and that we bring the position of the bed down to the lowest position. Do you want the head of your bed up?
Just a little bit.
Perfect.
That's good.
All right. And then last thing before I leave, going to be using hand sanitation, and that completes our skill for urinary female catheterization. We're ready to demonstrate male urinary catheterization now. I have patient Mr. Brown. He's already been prepped with what the plan is. He does not have any allergies, and he does not have any questions for me. Okay, we're gonna start with PeriCare first. And I've already provided for privacy, and I have good lighting. I'm going to raise the head of the bed up. Okay, that should be good. Mr. Brown, we're gonna start with cleaning your bottom area before we get started here. Okay, and same with as female, I'm gonna be opening up all 3 of these towelettes. There's 1. There's 2. And then there's 3. And you're going to be cleaning the penis with a focus on the urinary meatus. 1, 2, and 3. Now I'm going to discard my gloves and any of the garbage I have. My next immediate step would be to hand sanitize, and then I'm going to get the patient in a good position. So once again with knees up and then legs separated. Okay, Mr. Brown. I'm gonna move this a little bit. And I do want to give myself really a lot of room here. Okay, I'm just gonna move your knees up a little bit here. Is that okay? Mm-hmm. Okay. All right. So now I'm going to be opening up my cath kit here. Once again, trying to reserve that so I can use that as a sterile garbage. And I'll place that right there. Okay, so move this. I want to get my cath kit in a good position. Move your leg just a little bit. All right, now I'm going to put on my gloves. Well, before I do that, let me open this up. Okay. And once again, trying to keep those corners really tight there. Good. And I do have gloves in here, but I am going to be using those gloves. Okay, and I'm not turning my back on my sterile field at all. Don't forget to practice your sterile glove skills. Okay, Mr. Brown, how you doing?
Okay.
Good. Okay, all set. Now I don't need this set of gloves. I'm going to be placing this underneath the patient. Remember, wrap that up really well around your gloves. Okay. Mr. Brown, I'm going to have you lift up your bottom just a little bit for me. Thank you. Okay, good. And we also use a fenestrated drape again in order to provide privacy and then also to make your sterile field as wide as you can. We're not using the iodine swabs at all, and we're not going to be using this lubrication at all either. I'm going to move my tray right here. And I have my 10 cc's of sterile water. I'm going to pull back on that in order to break that seal. Okay, now I'm going to attach that to the balloon port here. Remember, do not test that balloon port, just attach that tightly. Okay, now I'm going to ask my assistant for the lubrication spray and then the alcohol. Thank you very much. I'm going to open up the alcohol swabs. I have 3. 1, 2, 3. And then I have my lubrication spray. I'm going to spray right here. Okay. Now I'm going to be removing the plastic covering. Make sure you have good control. Okay, good. You can remove the plastic. And I'm going to put that catheter right in that lubrication right here. Okay, now I have my non-dominant hand, and I'm going to be placing that on the penis in the upright position, perpendicular to the body. And this is going to be the position of my non-dominant hand until the catheter is inserted. Okay, Mr. Brown, I'm just going to be cleaning. Once again, you're focusing on the urinary meatus. And you really want to have that wide area, that you don't want to be close to that sterile field at all. And then one more. Okay, Mr. Brown, I'm going to have you cough and take some deep breaths. Once again, good. Once again, I want to be about 2 to 3 inches away. Okay, deep breath. Good. And if you feel any resistance at all, you would need to stop and let the provider know immediately. Now, with insertion for males, you're going to be going up to the point of the bifurcation. And then you're going to be anchoring that in place once again. Okay, then you can insert your water. Okay, then you give a little tug just to make sure that that is sitting well right in the bladder, and it is. Excellent, you did very, very well, Mr. Brown. Now I'm watching for the urine drain into the bag, and I'm going to be attaching that to a non-movable part of the bed. And I see about 300 cc's of clear yellow urine. Good, and I want to be attaching this to the StatLock stabilizer as well. Okay. Okay, Mr. Brown, you did very well. Now I'm going to be cleaning up my area, making sure Mr. Brown is comfortable. There you go, disposing of all the equipment that I have. Okay, Mr. Brown. I'm going to lower the bed. Do you want the head of the bed up a little bit?
No, I'm fine.
That's okay?
Yeah.
Okay. So I have the call light there. He's comfortable. I'm gonna take my gloves off. Gonna hand sanitize. And that is the completion of the skill for male urinary catheterization. And now we're gonna be doing documentation. Now we're ready for documentation for Mr. Brown. Let's go to his medical record. And I have under flow sheets, gonna be looking at interventions. And I see right here urinary catheter. So we're going to be adding the type of catheter that we inserted, the type, the French, the size of the catheter, the reason for the catheterization because patient was unable to void 6 hours post-op, and then urine description as well, and how the patient tolerated the procedure. So let's start up here with the type. That would be a Foley catheter. And we did an insertion. And then that was a 14 French. And then I was the nurse who inserted it. Reason for catheterization, patient unable to void 6 hours post-op. The drainage container would be a standard bag. And then the urine description was about 400 mLs of clear yellow urine. And then the patient response. Patient tolerated well. And that's documentation. What I see here is that a order just came up for removal of a patient's urinary catheter. So let's go ahead and remove that. Okay. Mr. Brown, you just got an order for removal of the urinary catheter. So we're going to go ahead and remove that for you. Does that sound good?
Yeah.
Okay. And actually, before I do that, and this is not a sterile procedure. So all I'm going to need is my 10 cc syringe for removal and gloves, and then we're all set. Okay, so now this is not going to be as uncomfortable as it was with insertion, okay? So what you want to do is you want to undo the stat lock, and you want to take out as much water as you put in. And you always want to pinch the tube a little bit, just in case urine comes out as well. So it should really kind of be flowing out on its own here. That looks good. Okay, deep breath for me, Mr. Brown, okay? Good job. All right, you did very well. Thank you very much, Mr. Brown.
All right.
Okay, then we'll get the patient cleaned up again. And that's removal of a catheter.